everyone, this is Dr. Mike Chua, physical therapist and certified dementia practitioner, and today we've got the special guest, Duane Dickerson. He's actually a nurse and a hospice care consultant here in Jackson, Tennessee. We're just here to ask him what does he do, what company, what services that they provide, and everything like that. So, what's going on, Duane?
All right, thanks for having me.
Tell us where you're from, what do you do, man?
All righty. Well, my name is Duane Dickerson. As Michael said, I'm an RN with Avalon Hospice. We're located here in Jackson. And my role is a hospice care consultant, which means I go and talk with the family in their house or assisted living or the nursing home. And we talk with the family and them about hospice, about what we do, and about what service we provide. And also make sure that they do qualify for hospice and to see what equipment and services they need. We have chaplain services, aid services, social work services, and nursing services. And we also have volunteers that come out.
Awesome. You mentioned about equipment, so that's very, very. I work in home, I visit patients at home, and we have a hard time getting all this equipment for our patients. So we do provide that services. So again, how do they qualify in hospice, and how do they get all those equipments? Can you explain that to us?
So what we need is a doctor's order, and they have to have a prognosis of 6 months or less on certain diagnoses, which could be ranging from Alzheimer's, congestive heart failure, COPD, cancer. So different types of diagnoses that qualifies them. But the main thing is the doctor has to write an order saying that they have a prognosis of 6 months or less. But do they always pass within 6 months? No. Sometimes we have them for a year, up to 2 years.
Yeah.
So no one really knows, except the man upstairs. So
that's true.
So some of the equipment, like let's say if we have a patient coming from the hospital to home, if they need a hospital bed, oxygen, suction, a wheelchair, rolling walker, any equipment they need, we can have it out there before they go home and get discharged.
Oh wow!
So if it's at a patient's home that they're already home, then we can get them that same day equipment, whatever they need, and Medicare pays for it all, or Medicaid, or the insurance. So and we can have it stat orders within 3 hours if it's emergent, especially with oxygen, because sometimes it is emergent.
Yeah, we need that. So
Yes.
you know that. So
Yes.
all right. So where can we reach you? I mean, what's your telephone number, your address, and everything
Yes.
like that? And what's the area of coverage that you provide this service? Because I see Avalon all the way down in Martin. I live in Martin, Tennessee.
Yes, well, Avalon Hospice, we cover the whole state of Tennessee. That is our coverage, the whole state of Tennessee. But our Avalon Hospice in Jackson office, we cover Madison County, we cover Gibson County, Crockett County, Haywood County, Chester County, and Henderson County.
Awesome.
And so we have all their offices in Bolivar, Dyersburg, Paris, Nashville, Memphis. So if they have a patient that from our office goes to another territory, we handle all that information and everything. So that way a provider, if they have a referral, they just send it to us. And then we coordinate with the other offices.
There you go. So what's your telephone number again, and your email and website?
Alrighty, my email address is ddickerson@avalon-hospice.com. Our office phone number is 731-736-2046.
All right. So we're gonna put all those information also in our show notes, just in case you didn't get it. So again, thank you very much,
thank you
Duane.
much.
Any last parting wisdom for our watchers and listeners?
Well, hospice is one of the underutilized services. There is. And a lot of people, they mention the word hospice and they think it's a bad word.
Yeah.
And so they're terrified of it. But once you learn the truth about what it really is and what we can do, it's not just for the people that are actively dying. It's not about that. It's about quality of life.
There you go. I love that. I love what he said, because my dad passed away, and we wanted to, take him to hospice, but we weren't able to do it until the last few days. And you don't want to wait for the last few days or last few hours to call him hospice. And like what Duane said, it's an underutilized service where you need to actually reach out to them as early as 6 months or 1 year, as long as the doctor decides that there is an actual terminal disease or condition. So if they qualify, go ahead and reach out to them. You don't have to get that actual service. Just go ahead and talk to them. Ask them what are the different services, because it's a higher level of care where they can send actually nurses every day, not just once a week, not just twice a week, not just once a week for like 5-10 minutes. They can actually provide that services every day, and sometimes they provide is it 24/7 care too? Do you have that?
No, but if you need if a family needs a sitter, we do have sitters that work with hospice patients. It's just they have to pay for out of pocket. We have a list of services that
You can refer them
they can
to.
refer them to if they like. Sure.
All right. Well, any last parting wisdom for our? I already asked you that, right? So
Just have a good day.
all right. Again, thank you very much. And before I let you go, always remember the word FAST. FAST. Letter F. Find friends that will push you to your next level. You are the average of the 5 people you hang out with. Right now, I hang out with Miss Tifa Snow. I hang out with Duane here. See, I mean, he's really fit. I feel like I'm also fit now. So later, I'll be working out because I see him. So what's the next letter? Letter A. You gotta learn how to take action. All this stuff that we're doing, it's free. It's not going to do me good. It's not going to do Duane good if you don't take action on it. Reach out to him. His website, we're going to put it on our show notes. Website, telephone number 731-736-2046. So take action. What's the next letter? Letter S. You got to learn how to shoot for the moon. I bet Duane shoots for the moon all the time because he's working out. He's just being the best that he can be. But guess what? You're going to fail. When you're taking care of loved ones, you're gonna fail. But when you fail, you wanna fail with somebody like Duane, somebody with Avalon Hospice. You wanna fail with Avalon Hospice because they're gonna help you, pick you up, and be the best that you can be. And last but not least, letter T. You gotta learn how to teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're gonna understand it more. That's the reason why we're here. We're learning from Ms. Tifa Snow. She's teaching it. Duane is teaching us. He's teaching me. So again, thank you very much. Be awesome. Be great. Be excellent. Thank you, Duane.
Thank you very much.
Thank you for your time.
Appreciate it.
Appreciate
Thank you. Thank you.